This class covers heart disease, heart failure, and heart transplants. We're going to start off some slides with a lot of recent data on the incidence of different types of heart diseases in the U.S. So if you take a look at these data from the American Heart Association, coronary heart disease or coronary artery disease counts for about half of all heart diseases in the U.S. Stroke is considered a form of heart disease. We're going to cover this more with the class on hypertension. Heart failure, high blood pressure in and of itself can be a separate heart disease. Diseases of the arteries other than in the heart, so you can have blocked arteries in your legs, and then there are other heart diseases, so things like congenital heart defects would fall in that range. So if you look at the number of deaths from heart disease, you can see the overall death rate is declining. So although it is still pretty high, that is because we have better preventive care. People are on medications for high blood pressure, high cholesterol. We have better care when they get to the hospital if they've had a heart attack. We have CPR with AEDs available at many facilities so that we can get emergency cardiac care ASAP. So that's the good news, is that people, deaths from heart disease are declining. The bad news is, if you look at this slide, is that heart disease is still the number one cause of death for both males and females in the U.S. Now, because of what we saw on the previous slide with heart disease deaths declining, there are some people that feel within the next 10 to 20 years that cancer incidence is going to go up and that cancer is probably going to overtake heart disease as the number one cause of death. And I think we've talked about that already. But if you look at the other causes of death between men and women, you can see that really the other conditions aren't even close to heart disease and cancer. So Alzheimer's by itself counts for very few deaths when we're looking at other diseases like heart disease and cancer. So let's break this down a little more. So if we're looking at white males and white females, so still heart disease overall, number one cause of death. Number two is cancer. So women having a little bit higher death rate than the men here. If you look at African American males and females, you can once again see death rate is much higher for women than for men, and is from heart disease. And overall for women die from heart disease because their symptoms are a little bit different, and oftentimes they don't go to the hospital, or they're misdiagnosed, or they're not going to have the classic types of chest pain, so sometimes they are missed and they don't go to the hospital. So so that is why we see more deaths in the women. And when you look at heart disease by age, so who gets heart disease? You can see in looking at various age groups, it's not non-existent in people 20 to 39. And with increasing numbers of childhood obesity, you have to wonder if eventually these numbers are going to go up in the 20 to 39 group. As children have poor dietary habits and these track into adulthood. But you can see once you get to 40 to 59, once you hit middle age, your risk goes up quite dramatically, and then it continues to go up. So like many of the conditions that we've talked about this semester, and we will talk about this semester, you do see an increased incidence with age, and that's pretty much across the board for many of the chronic diseases we're going to talk about. But overall, your risk is very low in your 20s and 30s, and then when you hit your 40s, a little bit older for women than men, so women get a little extra time because of until they hit menopause, but it does start to go up quite dramatically. And so when we look at the death from coronary heart disease, stroke, and breast cancer, for white and black females, you can still see that heart disease is far and away the number one cause. So breast cancer gets a lot of the publicity. Well, pink is everywhere, and there's a lot of breast cancer awareness, but the number of women who die from heart disease is much, much more than women who die from breast cancer. The good news is we are doing much, much better with cancer treatment and prevention. So even though a woman may get breast cancer, she, may not die from it. But heart disease is still by, far the number one cause of death for both white females and black females. And stroke and lung cancer still are more than breast cancer.